I am a publisher, writer, editor, daughter, sister, auntie, dog mom, and many other things, including currently a cancer patient. But I am not a doctor or medical professional of any sort. What you are about to watch is an episode of my journey through cancer. I'm sharing my adventure with you in hopes that you'll find something here that's comforting and maybe even inspiring. This video is not intended to provide any sort of diagnosis or treatment plan. Please go talk with your doctor for professional medical advice. When I was told about the side effects that I could expect to experience from chemo, my oncologist listed neuropathy as one of them, and that's the one that has me most unnerved. Okay, so what is neuropathy? Specifically, chemo-induced peripheral neuropathy, or CIPN. It is a common side effect of chemotherapy. 30 to 40% of patients will experience it. In a nutshell, chemo drugs kill cancer, but they also kill healthy cells. And some of the cells they can kill are nerve cells. And that results in nerve damage. So how serious is CIPN? That depends on the patient and how much of the chemo drug she receives over what period of time. The symptoms include tingling in the fingers and toes and hands and feet. They might include weakness, muscle cramps, fatigue, but they can be worse. They can include paralysis. It can affect and even shut down internal organs. It can leave a patient with long-term sensory pain. And it can be permanent or it can be resolved. And there are remedies such as physical and occupational therapy and medication if it gets really bad. But there are also ways to prevent it. And that's what I'm looking at first, although there's no surefire ways. There are steps you can take. And fortunately, I'm already on board with a few of them. So, okay, what are these steps? Walking 30 minutes a day. That can drastically reduce the chance of developing neuropathy because it gets your blood flowing and your muscles moving. And these things reduce the chances of developing neuropathy. So check on exercise. Strength training with weights or bands at least 2 times a week. And check, I'm doing that. Balance exercises. Because CIPN can impair balance, there are lots of websites that suggest simple exercises for balance. There's yoga, tree pose, and I have a balance board on order from Amazon, and I may do a video about these exercises in the future. Can avoid or reduce alcohol. Check. I've been off the sauce since the day of my diagnosis, pretty much. A few glasses of wine here and there, but I'm being really good. You can eat a healthy diet, especially eating foods that contain B12, which can help your nerve cells not to break down or to not break down as quickly. These include eggs and Greek yogurt and cabbage and shiitake mushrooms and salmon and oysters and shrimp and camembert cheese and Parmesan cheese. And these are all foods I love, but since the sort of chemo that I'm having also makes you lose your appetite, I'm adding a B12 supplement to my daily vitamin intake. And you can get a massage. One of the nicest treats in the whole world is a massage in normal times. But during cancer, it's almost a necessity. And I'll say that again and again. I have an incredible massage therapist, Liz Webb at Bliss Massage in my local area. She is an integral part of my cancer team. And, she's taken it upon herself to learn about specialized techniques to use with cancer patients. And I couldn't appreciate her skills and compassion more than I do. Acupuncture can also be helpful. I have never tried it, but I'm looking for a good recommendation in my local area so I can add this to the preventative mix. Having cancer can feel like a full-time job, and focusing so intently and narrowly on yourself, it can get boring. But you do it because you know that it's the way back to a normal life.
If you liked this video or found it helpful, give it a like, subscribe, and don't forget to ring the bell.